apparently he
This meeting is being recorded.
So with this, I will just throw open our CSR project presentation, but with the permission of jury, may I play a 2 minutes video for showcasing our Arogya project's benefits.
Go ahead.
Please. It's only 2 minutes, sir.
But please keep it in time. This is out of your 10 minutes of presentation.
Sir, definitely. Appreciate it, sir. Thank you very much, sir. Thank you for allowing us. Play.
Limited is India's flagship natural gas processing and distribution company. Besides this, GAIL also remains committed to the principles of corporate social responsibility through its flagship initiative, Arogya.
मेरा नाम विनोद कुमार यादव और मैं शुगर का पेशेंट और काफी समय से यहाँ से इलाज ले रहा हूँ और हमको होता है लाभ। आपका जो भी ये गेल से गाड़ी आती है, सुनना भी पूरा स्टाफ है, बहुत कर्मठ, ईमानदार, किसी प्रकार की कोई परेशानी नहीं होती, हमेशा सजा से दवा देते टाइम से।
मेरा नाम सिद्धेश्वर है। हमारे गांव में डॉक्टर आकर हमारा इलाज करते हैं और उनकी दी हुई दवाइयों से वो ठीक हो जाते हैं। हमारे गांव से सबसे नजदीकी दवाखाना डेकेनाल में है, जो यहाँ से 25 से 30 किलोमीटर की दूरी पर है और वहाँ जाने में हमें बहुत समय लगता है। इसलिए हमारी विनती है कि ये मेडिकल वैन ज्यादा से ज्यादा दिन यहाँ आया करे। ये मेडिकल वैन मुफ्त में हमारा इलाज करती है और दवाइयाँ देती है। इसके लिए हम गेल के आभारी हैं।
Project Arogya currently operates 41 mobile medical clinics across different states, serving 1 million underprivileged patients every year.
मेरा नाम कुमती है और मैं घोषैली में रहती हूँ। हमें डेकेनाल के दवाखाने जाने में बहुत दिक्कत होती है। इस मेडिकल वैन के यहाँ आने से हमें बहुत आराम मिलता है और मेडिकल वैन के डॉक्टर की दी हुई दवाओं से हमारी बीमारी ठीक हो जाती है। इसके लिए हम गेल के बहुत आभारी हैं।
मेरा नाम संत कुमार तिवारी। सबसे ज्यादा किसान हमारा दिव्यापुर जाने के लिए मजबूर है, क्योंकि वो दिव्यापुर में अगर जाएगा तो कितना भी पैसा खर्च करो, आपकी जो दवाइयाँ हैं वो दिव्यापुर में नहीं मिलेगी। ये यहाँ पर जो दवाइयाँ मिलती हैं आपको, तो इससे जो है हमारे किसान को तो बहुत लाभ है। इसलिए मैं तो यही जो कहना चाहते हैं कि हमारे को जो है यहाँ गांव में इसी हिसाब से जो है दवाइयाँ चलती रहा, तो मैं उनको बार बार जो है धन्यवाद और
GAIL India Limited, in the minuscule of its effort, has touched an enormous aspect of life by providing professional health care to the needy, as they believe if rural India breeds health, the nation brings progress.
Thank you very much, respected jury members, for being very patient with us. I just wished and you allowed to set this video, to allow this video to set the tone of the presentation, sir. This Arogya initiative is one of the 7 thrust areas that GAIL India Limited has identified to use for carrying out our CSR initiatives. Okay. So this umbrella which is visible to you, sir, GAIL spends, I will just take 1 minute on this thing, for since 2014-15, when the CSR Company Act, through Company Act, the CSR came into being as a mandatory spend for the major companies of India. GAIL has been conducting its CSR initiatives with the GAIL, and we have been doing it in these thrust areas like Saksham, Unnati, Harit, Arogya, Ujjwal, Sashakt and Kaushal. Arogya is the one under which this project is being conducted. In the video, you could have seen that the 41 number of MMUs were being run in the year of 18-19. Presently, in the current year, we are running 60 number of mobile medical units through this initiative. The total cost of running this operation is approximately 22 crores per year. The complete CSR spends of the GAIL India Limited are in the range of 125 crores to 150 crores based upon the profits that go up and down based upon the previous 3 years average net profit of the company. So coming back to the project again, sir, that's what I just wanted to give a brief to you. I will make one more statement, sir. GAIL India Limited, being a PSU, Central PSC under Ministry of Petroleum and Natural Gas, has been very consistent in outperforming the targets which are mandated by the CSR Company Act. In the CSR, we have been spending more than 2%. In 1 year, we spent 3%. In another year, we spent 2.6%. In another year, we spent 2.26%. And this is in last recent 5-6 years. Before that also, before Companies Act mandated CSR coming into force, GAIL has been investing into CSR, into the local communities, to keep a buy-in with the people, to interfere with their lives positively, so that they carry a good image of the company, and that actually helps us in keeping our brand intact and really visible and a pleasant brand. So GAIL has been doing this. GAIL has also been doing this CSR under the mandates of Department of Public Enterprises, when they say that 60% of the expense should go into the Arogya, into the health and nutrition areas. Also, we have been contributing to the Swachh Bharat initiative consistently. 33% of our CSR budget used to be for the toilets construction, when the same was taken up by our Honorable Prime Minister in 2014, sir. So with that, with this little backgrounder, I come back to the Arogya, the project of the current discussion, sir. The project Arogya was initiated by GAIL India Limited on October 4th, 2011, with the aim to cater a vast geography of underprivileged people in the need of medical services through mobile medical vans, providing free of cost primary health services at doorstep for poor, needy, and the remote countryside people having limited access to the health services. On this, sir, I will just put one emphasis. As per the study, the baseline study we got conducted in 2015 and 16, it is known that almost 35% of the PHCs, primary health centers in the rural India, they don't have the complete list of the complete manpower deployed there. Even those who are deployed there, somehow for some strange reasons, for well-known reasons, they don't turn up at those locations. So basically, this Arogya Mobile Medical Unit is one of such projects of GAIL India Limited CSR branch, that it actually meets the needs of the people, and it really helps us make the brand building that I was going to tell you. And as you know, approximately 16,000 kilometers of pipelines are being run by GAIL. They are running cross country, and we do touch the lives of people in slightly skewed way, because we go under their agriculture, and we don't allow them to do tree plantation or avocado plantation above the pipeline. So we touch their lives a little bit inadvertently, but that is the part of the business. We know for sure that for last 10 years approximately, when we have been conducting this project, it has been creating a goodwill among those people for us. And that goodwill is coming because of their prime need of the health, which has not been being met by the health system of the country. We cannot go to every nook and corner of India, but we are duty bound, and we feel our duty to at least impact the lives of the people in the vicinity of our pipelines in a positive way. Next slide. So the key achievements of this project Arogya, sir, whatever I told must have culminated into this feat for us. For 2014-16, the project Arogya was nominated the CSR Projects of New India by Government of India. It's written, a lot of things are written there. I believe I have spoken what was to be spoken. Next slide. Just brief features of this project, sir. I've been speaking about the features. In current year, financial year 2021, last financial year, for which duration this project is being presented to the respected jury for evaluation, we were running 59 number of mobile medical units. Currently, this year it is 60 numbers. The project Arogya touches more than 10 lakh odd people, the lives of 10 lakh people. This is very conservative estimate, sir. Actually, the numbers are 15 lakhs and more. I will tell you how, sir. What happens, a mobile medical unit, when it is run, it goes to 2 or 3 villages in a day's time. Then the mathematics goes like this. Every day, the mobile medical unit, the doctor over there is able to prescribe medicines and deal with people, approximately 100 numbers of them. Now, this mobile medical unit is made to run in such a journey cycle plan, so that the repeat visit to the same location happens in not more than a week's or 15 days time. So that's what our target is. We have to spread our resources thin to meet the requirement of the people whose lives have been touched by our business, and this is how we do it. So 18 out of these 59 MMUs are operated in aspirational districts across Assam, Bihar, Jharkhand, Madhya Pradesh, Odisha, and Uttarakhand. Sir, aspirational districts currently there are 112, and this is being monitored by the NITI Aayog, and they mandate that the CSR projects of PSUs, the CPSCs or major companies also should be spent in the areas of the aspirational districts so as to better the lives of the marginalized people. Now, these GAIL supported MMUs have made access to the primary health care easier for the people in the most remote rural pockets of the country, including the tribal belts like Jhabua, Madhya Pradesh, left-wing extremism affected areas of Jharkhand and hilly terrains of the northeast, sir. So with this, I will also submit that GAIL has supported various healthcare projects through this CSR initiative by setting up of hospital, provision of mobile medical units, provision of aids and appliances, provision of eye camps, health camps, and we also use this as a carrier for disseminating the information about Swachh Bharat initiatives of GAIL India Limited. In the said FY financial year 2020 and 21, MMU supported the local healthcare infrastructure across various geographies during the COVID-19 pandemic also, sir, and served in extremely challenging situations, sir. We really salute the doctors and the nurses and the people, the drivers who served in those tough times. The response from the public has been overwhelming for all of us, sir. We know what we have done. We just bring the joy to you, joy of serving others. Next. The project Arogya and COVID-19, sir, I will just share with you that such a program became all the more significant during the outbreak of COVID-19 pandemic. I mean, the movement of the people during the lockdowns, Project Arogya provided free healthcare service to the vulnerable and poor at their doorstep during these challenging times, sir. COVID times were really challenging, no need to overemphasize it. Taking cognizance of the ongoing pandemic situation, GAIL even scaled up the project to target wider geographies, and based upon success of the project, milestones were achieved. GAIL also supported the district administrations and provided support to them with mobile medical unit services during the pandemic. At this stage only, I will say that GAIL has, along with this project Arogya, we have provided cardiac care mobile medical units in Uttarakhand on Yamunotri. Badkot is the location. Cardiac care mobile medical units, two numbers we have given to Pratapgarh district in UP. So, likewise, sir, the Arogya is a wider umbrella. Mobile medical unit is the subset of it. So the each MMU includes qualified. Now this is the specifics of the project once again. Qualified MBBS doctor is always there. Nurse is there. NM nurse is there. Lab technician. We prefer the nurse to be the female. The reason being that in the remote locations there might be geographies where the ladies will prefer to be listened to by a female functionary. Then the the diagnostic kits and machine is there. The Swasthya Janch machine is there. Information and awareness material on health and hygiene is also available. Each mobile medical unit operation costs approximately 36.52 lakhs. Last year it costed this much. Current year it is costing 38 lakhs rupees per mobile medical unit. That's how the current year the cost is approximately 22 crores. Last year it was approximately 20 crores. I will say in the range of 20 crores. This extends the primary health care services to approximately 25,000 patients annually. One mobile medical unit, this is the data. So if I multiply 25 by 60, that's where I get the number of 15 lakhs and above. Swasthya Janch machine, the one that is always available in these mobile medical units, it conducts 22 types of diagnostic tests in the MMU itself on the spot. The free distribution of Moksha sanitary napkins to adolescent girls and women in the villages. We also use this project as a women empowerment initiative also. So the free distribution of this Shuddhu tablets for cleanliness of water. So in one project, we are combining women empowerment, clean water. We are trying to use the vehicle. A vehicle has been created. We are trying to use the vehicle to disseminate as much help and information as possible, sir. Coming to the quarterly eye screening and medical health checkup camps are conducted. Mobile medical units are GPS enabled and geo-fenced. This is very important part of the monitoring part of the project, sir. Not only we have spanned out this project, we also want to ensure that these mobile medical units are running in the areas that they are intended to, we create a journey cycle plan for every mobile medical unit. It's basically a forced traveler vehicle. It is quite a spacious vehicle. We need to monitor whether it is running on daily basis or not. The control room knows at any point of time the location of any MMU across the time, sir. Now coming to the scalability of this project, sir. In 2021, GAIL supported 59 mobile medical units and touched more than 15 lakhs of people. 10 lakh is the understatement that they are making. 15 lakh number is the one that I would like to speak. Comprehensive model to address the healthcare needs, sir, as I explained. Taking care of the rural health, sir, as you could see here from the testimony of the people who have availed of the services of the mobile medical unit, you will see that they are really thankful to. There are people who did not know that they were hypertensive, and because they were detected, because these vehicles went into the remote areas, their life was saved, sir. We really take joy in knowing, and really it gives us those good happy hormones when we know that this initiative has been helping the people who would otherwise not be helped, who would otherwise not know, and they will just end their lives, short of the actual that they should live. 80, 90 years people should live. Someone in a hypertensive condition, not detected, those facilities are available to the city folks, but not to the village folks. Project success ensures scalability and replicability. Sir, it is entirely replicable. That is the reason, sir. I will tell you what is happening in GAIL's pipeline locations. Wherever they know that GAIL is coming, wherever they know that GAIL is operating, people's expectations go up. They know that, okay, abhi to kuch nahi hota tha, but a mobile medical unit pe log chala hi denge. So they look up to us. This is a mobile project. Now, if we feel at some point of time that any particular location, the primary health centers have come up, because government is also working day and night to make the health facility available to people. So we will move our operations to those locations where the needs are felt more. As you will see, almost 6 numbers we are running in Odisha, almost 5 numbers we are running in Madhya Pradesh, Guna, and about 5 numbers we are running in Jhabua, that is another remote location. So they are in remote locations, sir. Please be appreciative of the fact that these mobile medical units are running in remote locations only and serving the underprivileged people of the society. Next slide. Oh my God, I was so much in flow, but thank you very much. This is almost all I had to say. Any questions, please, sir? Respected during this.
Members.
And this is a very good project. I think it's a excellent service which is being given to some of the remote villages. That's very, very good. Excellent, I think.
Sir, thank you very much, sir.
This is, I mean, as I said, nothing could be more important than one contribution, whichever way, for the health and well-being of the people, especially those who are remotely placed and deprived of such services, and very much need of it. Now, your mobile, services are a great thing, but you see, I just want to mention the curiosity to know. It's not that nothing. One mobile van, how much area?
Yes, sir. Yeah. Allow me to answer to that question, sir. This one mobile medical unit, as I explained to you, has a journey cycle plans and runs in approximately 40 to 50 kilometers of the distance from this base location, so as not to stress out the staff also. And one particular figure I was missing, maybe I was looking for the opportunity to share with you. The per patient cost is approximately 100 rupees only. The way we operate it, the efficient way it is operated. So the figures you asked, 40 to 50 kilometers, 6 persons headed by a doctor, and per person cost approximately 100 rupees, and people are really satisfied, sir. The video was testimony.
On an average, how much time a vehicle spends on the road and other locations in the village or the place where you provide the services?
Sir, I would say 2 locations to 3 locations. 3 locations is off peak. Generally, a van goes to 2 villages. We have ourselves seen per day approximately 4 hours to 6 hours is the duty time along with the villagers, and balance of it is, sir, 1 hour running this way and that way. It's of course variable, sir. We appreciate it.
And thirdly, that the vehicles, are they fixed to one place, or they can keep moving one place to other, staying 1 month, 2 months there, so that more areas?
Yes, sir. As I told you, sir, this is a project where the what I will say, where the saturation is also very important, sir, and the expectation of the timeliness is also important. So, for 1 year, we get the project approval for 1 year from our board of directors. For one location, for one journey cycle plan, 1 year is fixed, sir. But what has happened, sir, since we are running in the remote locations, we don't see much of an opportunity of moving from one place to other. Presently, we know that as the things come up fast, we do expect to move from, let us say, Jhabua, let us say, Guna in Madhya Pradesh, let us say, Khera in Ujjain, Khera near Ujjain, sir. So, since we are catering to the remotest locations, sir, we really don't see an opportunity to move them quite often. But we do hope that that the things move so that we are able to move to further more needy locations. But sir, we are almost sure that we are at the what you call bottom of the rung as far as serving the public goes, sir.
And are you going to expand your activities on the health side?
Sir, as I will submit to you, sir, approximately 50%, to tell you very frankly, health and nutrition, 60% is the mandate by the DP that we should spend on, and we spend almost 70% on health and nutrition, out of which almost 60% is this project particularly. Now, just to share how we have expanded, sir, in 2009 and 10 when we started, 10 and 11 we started with 5 mobile medical units, or 4 or 3. Now, in 2017, we had 31 running, sir. Now we have 60 running, sir. Actually, sir, to submit to the jury, sir, for a CSR budget of 150 crores odd every year, I think this is almost the size we have reached, and making it bigger for us is going to be strategically very challenging, sir. Unless a company takes a view that, okay, we will spend all of the money on the mobile medical units, which of course is a very good initiative.
Okay.
We do another initiative.
How have you selected the areas of operation?
As I told you, sir, the CSR Act mandates GAIL India Limited, mandates the companies to prefer their local areas. So the selection of the areas is generally where our pipelines are running, sir. Generally where our pipelines have gone below their properties, so they know they expect something from a company like GAIL India Limited, having a turnover of 70,000 crores per annum. So, sir, answer your question, in our local areas, we do prefer, sir. And definitely the local representatives do come up asking. Yeah.
And the medical records and histories, do you share with the primary center? Because eventually when you leave, they will have the gain of knowing the situation.
Sir, I will tell you, sir. I will answer this question, sir. Since this was an initiative in the remote locations here, there was no infrastructure earlier, health infrastructure almost. So we did a practice of informing the chief medical officers of respective districts invariably. We inform them that this mobile medical unit is running. And sir, just to share with you, we do have all the records during the COVID pandemic. Lot of district administrations, because they knew that these facilities are available, they requisitioned our mobile medical units for COVID duties also. Of course, they performed it using PPE kits and all the precautions that they had to take. So we inform them, sir, and we keep them informed, sir.
Thank you. Good job done.
Thank you very much, sir. Thank you very much, respected jury, sir. Thank you.